Hi, my name is Amanda Santiago, and I'm a preclinical health sciences major.
Hi, my name is Jubilee Contreras, and I'm a biomedical science major.
Hi, my name is Tyler Walker, and I'm an interdisciplinary studies major. We chose the Pro Affordable Healthcare Act because we felt like America needed a healthcare reform, as our healthcare system has a lot of flaws, and we're going to tell you the reason why it is a good thing for our country.
Just to avoid further confusion, Obamacare and Affordable Health Care Act are not different. They are the same thing. A lot of people try to differentiate the two merely because of their names. Turns out these two things are one entity that evolved over time. The Affordable Health Care Act was passed in 2009. Following this was the Patient Protection Act, which then turned into the Patient Protection and Affordable Care Act in 2010. This is also the Affordable Care Act that President Obama signed into law. Since in office, Obama has been working on the battle to reform healthcare insurance for overall affordability and of quality. That is where the term Obamacare comes in. Overall, these terms mean and speak of the same thing. What exactly does the Affordable Health Care Act do for you? If you are already insured, your benefits will enhance from this change. If you are uninsured, you will not only have affordable health care, but will have access to quality care. Ladies, wonder how this will benefit you? Women will benefit from this act specifically for preventative care and lowering the cost for these procedures. Statistically speaking, women utilize medical services more than men do, so it wasn't a mystery why women were paying more. Now, preventative services such as contraceptives and counseling will be accessible to all women. This is very important to control the population of young pregnancies. Other services included are HPV vaccinations, DNA testing, mammograms, and colonoscopies. All of these visits will be covered and prices will not be inflated. This change will not only improve the overall health of women, but prolong their life. More than half of the women in the U.S. were avoiding or postponing preventative care because it was too expensive. Now they no longer have to carry the burden of these expenses. So, for all of you college students out there, or anyone under the age of 26, I'm sure you're wondering what this act can do for you. Well, let me tell you. Thankfully, with the health care reform, students aged 26 and under are allowed to stay on their parents' health insurance if you're not covered by an employer-provided plan. If you live far away from your parents, which most of us do, all you have to do is check for in-network providers next to your campus. If your parents don't have insurance, you can shop for your own individual plan on websites such as ehealthinsurance.com or healthcare.gov. There are many plans specifically for college students. These plans will cover a minimum of 10 categories, and they are as follows: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse, prescription drugs, rehabilitative and habilitative services, laboratory services, preventative and wellness services, and chronic disease management and pediatric care. At least 60% of their actuarial value is required to be covered by law. This is a great advancement in our healthcare that will alleviate the burden that comes from these expenses. This can prevent many families from getting into debt. Now that you know how the young will benefit, how about the elderly community? Seniors will no longer have to stress over paying fees on preventative health care. These services will also be covered. Before the Affordable Health Care Act, it was required through Medicare to pay for preventative services such as cholesterol checkups, cancer screenings, and more. This is a great advantage for the elderly because these are typically procedures that can prevent illnesses that may turn into chronic diseases. To overcharge before was misguiding the idea of prevention. If you can't afford screenings or checkups, how can prevention be implemented in the first place? Another plus to this reform is that insurance companies will no longer be able to increase their premiums without any legitimate reasoning. There will be a cutoff of 10% allowance increase. With all of these benefits, there comes a downside. In order for a reform like this to happen, there had to be an immense amount of money spent. This is one of the biggest concerns that Americans have about this act. There will be new taxes implemented in order to fund this reform. This will mostly affect the wealthy that will earn more than an average of $200,000, $250,000 if married. A lot of people were upset by this new tax, but if they can afford the tax increase, then they would be the appropriate group to target.
Thanks, Amanda, for explaining what the Affordable Health Care Act is and what it can do for Americans as a whole. Now I will explain to you why this reform was needed. Healthcare Reform 101. There is about 47.3 million people in this country that have no health insurance, and about 38 million that have lousy health insurance. So basically, these people have to pay a higher copayment. Their insurance does not pay for basic treatments that they need, and their insurance does not cover their medication. That is about 1/3 of Americans that face the issue of not knowing if they're going to get health care or if they have the right insurance to help their families get healthy when it is needed. Without health insurance, most people will not seek health care treatment to get the basic things like vaccines or even an annual physical because they are limited in their choices. Uninsured do not have regular doctors, so they don't have that doctor-patient relationship, and that can cause distrust between the patient and the physician. With seeing different doctors, it can increase the risk of unnecessary, preventable errors. Some uninsured live too far from free clinics to get treatments, and with that are hospitalized for health conditions that could have been prevented if they had access to affordable health care. No health insurance can mean limited access to medication, to treatments, but mostly the big issue of delaying care for the fear of medical bills that most uninsured can't afford due to high healthcare costs. There are many factors why there are 47.3 million Americans that don't have health insurance. 61% of the uninsured are uninsured due to the fact that they cannot afford health care insurance, or they lost their coverage when they lost their jobs during the recession. So basically, no job plus no money equals no health insurance. 8.8% aged out or left school, so they no longer qualify for health insurance. 1.5% don't need the insurance. 11.2% are not offered, and 17.4% just don't qualify. Most uninsured are self-employed or they work for small businesses that there is little to no benefits offered. Some uninsured are low-waged workers that cannot afford coverage that is being offered to them. And some don't qualify for health insurance due to pre-existing conditions. But things are changing in the healthcare market due to the Affordable Health Care Act, aka Obama. For those already insured, you have received new benefits and rights and protections. For example, you can't be dropped if you get sick, and your payments will not get inflated because of it. If you're a woman, you don't pay more. The Patient Protection and Affordable Health Care Act can be a complicated thing. So let me show you a video that can break it down and explain it to you easily.
Well, it's finally happening after years of drama on Capitol Hill. A Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks but didn't. The marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in. And big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all. But let's begin in the workplace. Many Americans are already covered by their employers, and for them, not a whole lot will change. There will be some new advantages, though, like caps on how much you have to pay out of pocket, and free preventative care. The bigger changes are coming for those who work for larger companies but aren't covered now. That's because the government is going to require companies with 50 or more employees to cover full-time workers or pay a penalty. So, more workers may find themselves covered. Smaller employers won't face the same penalties for refusing to buy insurance, but they'll be encouraged to do so. The government will be setting up special marketplaces to make it easier for small employers to take the plunge. Some will be offered temporary tax breaks if they do, and unlike now, insurers can't inflate prices if some employees are sick. So, many of us will be getting covered at work. A lot of us will be covered with help from the government, just like today. Not much will change for seniors on Medicare. The law has already started helping with prescription drugs and better preventative care, and that will continue. Medicaid, on the other hand, is expanding to cover more of us, especially poor adults, many of whom aren't eligible today. If your income is low, Medicaid will cover you, most likely in a private insurance plan. But there's a catch. The Supreme Court ruled that governors and legislatures of each state should decide whether or not to be part of expanding Medicaid. In states that get on board, the feds will cover almost all the cost. But for those who don't, you may be left with the same options you have today if you're poor. So you'll want to check out your state's decision if you think you might qualify for Medicaid. Even with employer coverage and the expansion of Medicaid, a lot of us will still be left out. For those not covered or who find their work coverage too expensive, a new way to buy insurance on our own will be popping up everywhere. They're called health insurance marketplaces, though they may have a fancier name than that in your state. The health insurance marketplace is like a virtual insurance mega mall. Here you'll find private insurers competing for your business, and you'll be able to pick out how much coverage you want and how much you want to pay for it. From cheaper, high-deductible bronze plans to more expensive platinum plans. Still, all plans will cover a comprehensive set of services like hospital and doctor visits, maternity care, mental health care, and drugs. Most everything any of us need, at least when it comes to medical care. As with Medicaid, not all governors are on board to set up these marketplaces, but the feds will open their own in those states, and so you probably won't notice much of a difference. One big advantage of buying insurance through these new marketplaces is that the federal government will provide most people with a tax credit to make insurance more affordable if you don't have any other options and your income is below a certain level. In fact, most people buying on their own will be eligible for a tax credit and won't have to pay the whole premium themselves. And the marketplaces will make sure that insurance companies operate fairly under strict rules. They'll have to offer everyone insurance even if they're sick, and they won't be able to charge more for pre-existing conditions. Unlike today, men and women will pay the same price. And prices for older people will come down, while young people will pay more. To keep costs down for young people, though, they'll be able to stay on their parents' plans until 26 and buy low-budget catastrophic plans until they're 30. Of course, all these changes still don't mean insurance will come cheap. Most people buying their own coverage will end up paying less with the new health insurance tax credits. But some people will have to pay more, even though many of them will be getting better and more secure insurance. So let's be realistic. Not everyone's going to run out and buy insurance. Some might say, hold on a minute. If I can't be turned down or charged more, why not just wait until I get sick or injured to buy insurance at all? Well, first, you can only get coverage during special enrollment periods, so if you snooze, you may lose. And second, thanks to something called the individual mandate, if you're not insured, you pay a fine, making this option seem not nearly so clever. Still, if you really can't afford to buy in and can't get insurance anywhere else, the government will waive the penalty, so don't panic. By now, you've probably noticed a lot more people will be getting a lot more coverage. Where will the money to pay for that come from? Taxes, many of them targeted at the health industry itself, even tanning services. Yes, individuals will pay too, mostly the wealthiest Americans, who will be paying more into Medicare. Also, hospitals and insurance companies participating in Medicare will get paid somewhat less. Not painless, but somebody's got to pay. So, as Americans prepare for 2014, how will you be covered? How would you like to be? Now's the time to figure it out and get on the path to setting yourself up for the best insurance at the best price. After all, who wouldn't want that?
So by now, you should have a broad overview of what the Affordable Care Act is. And when I say broad, I mean broad, because the reality is the ACA, or what they call it, Obamacare, is a very complex legislation, and it's extremely hard to understand. And this complexity is arguably the biggest reason why Americans are terrified of it. And as you can see in this representation, the original Affordable Care Act was far less complicated than the present-day Obamacare. And this is due to massive amounts of regulations and exemptions that were added a posteriori. This complexity has left Americans divided in their views of Obamacare. So, where does America stand in our healthcare system currently? I mean, we are the United States of America. We're obviously like the best of the best, you know? I mean, number one on every category, correct? Well, you might be surprised. So as we learned early in the semester, healthcare systems can be judged on two classes: average life expectancy and infant mortality. Now, before I get to our rankings in that, I will tell you how much we spend on our healthcare. So our GDP, which is gross domestic product per capita, is 17.9%. Remember when I talked about how America should be first? Well, congratulations, we are number one. We are ranked number one, way above any other country. So in a nutshell, that means that we spend 17.9% of all of our money that we make as a country into the healthcare system. And again, I'm going to stress that that is way higher than any other country. Also, the price per person, which is PPP per capita, is $8,508, which again, you know, we get another gold medal. That's way above, and we're first, ranked first. Am I building up some pride here, some national pride? So in a nutshell, the amount on healthcare that we spend, you know, per year, and how much we spent in 2013 was $2.8 trillion. Again, you know, round of applause, that's first. So, you know, you should be feeling really proud right now. Well, about to pop your bubble. Because, you know, with all this money that we spend in our healthcare, we should have number one average life expectancy, right? And we should have the number one infant mortality rate, right? I mean, that only makes sense if we spend that much money on our healthcare system. Yeah, no, that's not how it's working presently. In fact, America ranks 35 in average life expectancy with 79.8 years. Then that's the average of how long one of our citizens will live. Now that, ranked 35, opposed to paying the most, that's not a very good efficiency right there. Let's go to infant mortality rate. Now, infant mortality rate, if you remember right, is something that judges how advanced our technology is, and it judges it by how many how many deaths we have per 1,000 live births. So ours is 5.2 deaths per 1,000 live births, and that's ranked 57th. Yeah. I was surprised too when I first saw this. So, spending $2.8 trillion in 2013, 17.9% of our gross domestic product, and we aren't even seeing the results. It is painfully obvious that our healthcare system is far from efficient. In fact, a recent study done by Bloomberg took 48 countries and ranked them by efficiency of their healthcare system. They accomplished this ranking by taking countries' life expectancy, relative cost of healthcare per capita, which is the GDP, and absolute cost of healthcare per capita, which is the total healthcare expenditure. It took all of these things and calculated to see which countries had the best or most efficient healthcare system. And in this study, they calculated America's healthcare system to be approximately 20% efficient. These results placed America ranking 46 out of the 48 countries, with only Serbia and Brazil below. These results are kind of humbling if you think about it, and they begin to paint a picture of why a healthcare reform was imperative. So what can America do moving forward? We've already taken a big step forward by implementing the Affordable Care Act, but what else can be done to combat this daunting issue? I mean, is Obamacare enough to turn this around? The answer to that is no. I don't believe that Obamacare is the answer in our present danger. But wait, aren't we supposed to be pro-Affordable Care Act? Yes, we are. That is correct. As a group, we discussed that the United States was in dire need of a healthcare reform, and that the implementation of an affordable healthcare system was a huge step in the right direction. However, we aren't completely convinced that Obamacare is the right system presently. Now, let me expand on my last statement. Now, in the tech world, when a program is released, they put the tag beta on it, as if to say to the consumer, this is a new program you're testing out, and there will be some kinks and glitches that need to be ironed out. Now, I believe that Obamacare is in its beta stage, and that overall, it may be a great concept and it may work for our country, but it has some design flaws that need to be assessed before moving forward. 1. Obviously, cost is a big concern, and a lot of people are arguing that the present system is far too complex, and consumers will still have to deal with the frustrations of multiple private and public insurance companies. This flaw alone does nothing to reduce the overall costs of healthcare. In fact, the increased complexity and addition of regulations and subsidies may actually increase overall healthcare expenditure. A second design flaw that needs to be assessed is a long transition period. Complete implementation of Obamacare is estimated to take over 8 years. This large time frame is mainly due to the complexity of the legislature and the requirement that every state needs to set up its own health exchange. But it could also be an attempt to reduce the shock of this major change. However, this long transition only increases the costs of the change over time. A third issue that needs to be assessed is a lack of enrollment through the marketplace. The new system uses a marketplace for people to sign up for insurance. In order for this new legislature to be effective, the system needs millions to sign up, and that means everyone, healthy or unhealthy. It was estimated that only 365,000 Americans signed up during the first 2 months of marketplace enrollment. This lack of enrollment is a serious problem, as it creates a situation where middle-aged, healthy individuals are choosing not to sign up because the fine for not enrolling is far less than what the increased monthly rates would cost them. If you have an insurance money pool filled with individuals who are taking out money and no healthy individuals putting the money back in, it will only dry out the pool and increase the deficit even more. A fourth issue that needs to be assessed is the promised subsidies. About 85% of individuals that sign up through the federal exchanges are being promised subsidies that will lower their cost of their insurance. These subsidies are being challenged presently due to the lack of enrollment in the marketplace. Without the healthy consumers putting money into the system, there isn't any money to give away, so to speak, to the people that qualify for the reductions. So how can these problems be remedied moving forward with an affordable healthcare system? These issues aren't going to magically change with the push of a button, but there are a few things we feel should be changed. First thing, raise penalties for uninsured. If the law is implemented in order to get Americans to sign up, and if it is supposed to be a universal healthcare system, then the government should raise the individual penalties for those who aren't signing up. A $95 fine isn't enough to make someone want to sign up for insurance, as they know it will cost more money to sign up than to just pay the fine. This will hasten the implementation process, as it will fill the insurance marketplace quicker. If this program is to be sustained, everyone, healthy and unhealthy, poor and rich, needs to be behind it. Second thing, give individuals who sign up now tax credits toward healthcare purchases. Presently, there is a guaranteed issue that allows one to pick up insurance at any time during the period of enrollments. So what is stopping somebody from waiting to sign up until he or she gets injured, or just wait till they need the insurance? Why not give an incentive for individuals who sign up now and penalize other individuals for waiting till they get injured or sick? This incentive would raise enrollment and overall lower costs to the system. So, by confronting these issues and tweaking them accordingly, the enrollment would drastically increase, therefore increasing the amount of money coming into the system. And with that increase in money, it would give the government the freedom to move forward in perfecting our new healthcare system. Now that we've assessed some issues pertaining to our healthcare system and the possible solutions to these issues, I would now like to point out and discuss other issues that affect our healthcare expenditures. Because the reality of this whole situation cannot be summed up as America just has a horrible healthcare system. No, there are other confounding variables that have directly affected our present outcome, and those need to be evaluated. Presently, 75% of healthcare costs are due to chronic diseases such as heart disease, cancer, stroke, and diabetes. These chronic diseases cause 7 out of the 10 deaths in the United States. Although the implementation of an affordable healthcare system is beneficial for those suffering from these chronic diseases, without looking at the prevention of these chronic diseases, we will keep throwing money into the system and still get a negative outcome. For this reason, increasing education on the impact of healthy diet, regular exercise, and non-sedentary lifestyle should be stressed moving forward, as well as promotion of healthy foods. As a country, if we are able to alleviate these confounders, we will make progress moving forward. So how can we get everyone on the boat, so to speak? What can we do to alleviate this division we are experiencing in America? The resolution of this issue is first and foremost in moving forward, as Americans should be united as a nation. Can we find a common ground? Let's see if we can sum up the affordable healthcare in one concept that almost anyone can relate to. Let me ask you this. Can we all agree that our healthcare system is flawed? Can we agree that a broken bone shouldn't be something that can bankrupt a whole family? Should an accident really cost so much it forces someone to sell their home? Should someone suffering from a debilitating back or joint pain be forced to deal with it because they can't afford the care necessary to alleviate or even fix the problem? The Affordable Care Act can be summed up to this. Every human being has a right to a standard of living with adequate health and well-being for the individual and their family. Isn't that something we can all agree on? I'm tired of hearing about someone's life being ruined because they were involved in a car crash and their insurance didn't cover them. I'm tired of hearing about someone who had to sell their business and file for bankruptcy because they had a back injury. These things shouldn't happen to our hardworking citizens. Our citizens should feel safe and protected. That is why the Patient Protection and Affordable Care Act should be supported moving forward.